We were told many times, this is never going to work. You can never do this.
Right. How do you do it? You don't listen to the critics. You just do it by example, and they will see. We may not be able to do everything, but you know, what's the value of a human life? I can't change all the world, but I can change one life at a time.
Ghana is a country of almost 28 million people. There's less than 3,000 physicians, less than 2,000 PAs right now for that population.
The United States, we spend more money on healthcare than any country in the world, and our overall life expectancy is only 78. And here in Ghana, they spend pennies, just fractions of that, and the life expectancy is around 62, 63. They've really developed a healthcare system that is able to be very efficient with its resources, and we could learn a lot from that efficiency.
Just been a path that seemed to have already been placed for us to walk down.
It's not about credit, it's about getting there, but we start one life at a time and we keep building from that point.
Today is the birth of Ensign College. Today we had the inauguration to announce to the world that there's a College of Public Health in Kpong.
We're here to celebrate the inauguration of the Ensign College of Public Health being opened in the country of Ghana to contribute to the scholarship mission of higher education in this region.
We want to say a good welcome to all of you here for honoring our invitation for this historic occasion.
Prevention will save untold lives here, untold lives. And so these workers have a chance to not be the curers, but the preventers, and save many more lives than just the one person walking into a hospital already sick. We'll prevent the people from ever becoming sick by teaching the proper habits, disciplines, and routines. And that's why a public school of health was so needed here.
All of these efforts are meant to provide
neonatal mortality, infant mortality, childhood mortality. All these things are issues that a public health college like Ensign can provide evidence-based research that can be translated into policy and implemented for the benefit of the people of this country.
Here we can bring it together and create an interprofessional experience with the public health experts, with our physician's assistants, with our nurses, our pharmacists, our physicians, and start to really bring it all together here. And that's the kind of model that we need to adopt more in the States, and as a model also in terms of training that will be so enriching here.
They have been very, very helpful. In fact, they've been instrumental in us getting this program off the ground. So we appreciate that so much, and we'll continue to work with them to strengthen this collaboration even more.
We are here to help focus on the community. Now it is our responsibility to get the community engaged and bring what public health is all about in our community.
The strategies that are being developed to address those resource challenges here actually have very good relevance to the work we're doing in healthcare transformation, in this approach to population health and wellness, in so many things that we struggle with in the United States. And while at the surface they may look quite different, at the heart we're finding they're very similar.
I'm a Ghanaian from the central region. It's beyond my expectation because the kind of faculty we have and the facilities and the kind of training that had been enrolled into us, it's good. It's good.
Ensign has something unique that they want to create a name, and you could see that everybody is eager to impart something special. It was a great opportunity for me not to miss.
I'm a Ghanaian from the northern part of the Volta region. I'm a working mother at the same time a student, so it's quite challenging, but it's worth it. We have very good lecturers who have also had training abroad. And then we have a very good faculty, very efficient faculty. So I think it's just good to do it here.
I'm from Ghana, from the Ashanti region in Ghana. The world is now a global village, and what is happening in one country easily rises to another place, and everybody should be involved. Public health is about disease prevention, health promotion, and disease prevention is individual based. Everybody has to prevent disease.
We are also grateful for UTA collaborating with us. It's an opportunity to have a university of that type to collaborate with Ensign.
There's a lot to do, and then to give back to humanity, to give back to society, and that is serving the public, serving humanity, and that is public health. And Ensign is teaching us to do just that.
We are so grateful to Lynette and Bob Gay for their vision, for being able to even imagine that this School of Public Health could be built here in Kpong, Ghana, and to include us at the University of Utah in part of their dream. We're delighted and honored to be a part of it, and we really look forward to bringing it all to fruition.
I couldn't even tell you how ingrained it is into the culture when people get sick and they die, that it's always God's will. Because that's the only way they have to justify what's happened in their life. And that the culture would become that it's not God's will, that we can prevent this, and that there is an educated, younger generation that is then beginning to move forward in teaching people how to live and not how to die.
You can't come to Africa without your heart being changed.